introduce myself. I'm Kristin Gharst. I work at the Autism program at CTF. We're located right beside Sarah Bush on Lotsa Road. And I'm a graduate of the EIU Family Consumer Sciences program with an option in family services. I graduated class of 95. I'm also the parent of a child with autism. So I've shared a little bit about onset because back whenever I was in the program, I got a really good in-depth knowledge of what typical development was. I never had an abnormal side class and really didn't know what abnormal development was like. So I'm going to go over those kinds of things with you, as well as what are some strategies that are helpful and different resources, because a lot of times in our state, trying to find resources, as I like to call it, connecting the invisible dots, it's very hard to find out what's where and how to get it. And I listed things, but I can get websites for you. I didn't embed them in there because a lot of times on the PowerPoint sites they're hard to read. And you can always contact our office, as well as some of the other offices that I'm listing for you. There's handouts that you can grab. I kind of want to find out from all of you, though, what kind of background you're from. I had talked to a few people when this room was pretty empty. Who in here are teachers? Like teach family and consumer science? Okay. Who in here are college students? And who is not any of those? Everybody in here is either teaching family and consumer sciences or is a student. How many of you in here are family services majors? Okay. So this is one thing a lot of times when you look at career options too, people would probably not think that this is a career path you would get into. You'd probably be doing social work, which this is a form of that, but it's not. You learn some of this stuff through the School of Hard Knocks. I worked also before this job at a Parent Training Information Center. So I actually help explain special ed law and rights to people as well. So what are your plans as far as what you're going to do after school with your family services option? Anybody got ideas? Well, some of the things that I'm going to talk to you about here too are going to be things that we actually offer daycare training, things that you can bring into a daycare setting. First thing I'm going to talk about is, I think I skipped a slide, but I was going to go over some of the different impairments. There's an impairment in communication. Children with autism, if you look at your normal developmental milestones that I had there on the Act Early purple little rectangular handout there, those are typical development. And there's another handout that I gave you that I'll be having on a slide later, which is atypical development. Lack of showing like a gestural point is usually one of the soft signs early on, as is the lack of communication. Typically when you're having a baby, they typically are going to babble at about 6 months. They're making the buzz sounds and they're sharing back and forth with you with response. Their pitch and intonation generally has variation in it. When you're working with a child that has autism, sometimes that doesn't seem really apparent. What most people know as signs of autism is that a child might be rocking in their crib, or they get frustrated and they headbang, or they line up their toys. We can kind of go over that in a little bit, but that isn't always the case. You can have the child that is the too good baby, meaning they really don't fuss much at all. They're really just happy. And that was the son we had. He was not at all an unhappy baby. You'll see that in pictures later. He was the child that really just liked being held. He didn't even try to eat most of the time. He was just happy. So we had a colicky baby later, and we're quite sure what to think about that. They have repetitive behaviors and restricted interests. Our son really only had interest in technology. Some kids like blocks, Legos. The big thing everybody thinks is trains. How many people in here said, oh, most kids with autism just like trains and Thomas the Train? A lot of you heard that? Okay. That is the very first thing they'll get asked when a child goes, is your child on a train? Or, well, what's their specialty?
Oh, for goodness sakes, that's cool.
Because they've
That's
seen
not
Rain
cool.
Man.
That's stupid.
Well, you guys can sit on the inside here. They'll say, what's your, their specialty, what's their
That's
gift?
stereotype.
Because they've seen something, and that's not anybody's fault. That's just their lack of knowledge that they know anything more than that, and that's our job to help educate people. On atypical development, you can kind of see here, I've got a handout there for you that's, let me grab hers and show you. This one here, you guys see that one? If you look at some of the differences when you compare these side by side with the typical and atypical development, sometimes when you're calling the child's name, that child's not going to necessarily turn to respond back and forth with you. They might have if you have something they want, they might very well turn to it. So sometimes people mistakenly think children with autism are deaf or hard of hearing. And the doctors will make you go through audiological assessments and rule all of that out. Another thing that you're going to see is they don't necessarily repeat things. So mimicked speech, you might hear, and that's another thing when you're taking your infant to the doctor. When you're in those settings with the doctor, you're going to be asked lots of questions like, are they babbling, are they saying sounds? They might be making sounds, but they might just be imitating your sound, not using it as purposeful speech. And you can see here too that the child doesn't understand necessarily simple questions. Between 12 and 36 months, you can generally ask a question, get a response. The big thing for you to know too is with a child that's maybe got Asperger's disorder, which is now being faded out of the Diagnostic and Statistical Manual as a diagnosis. It's been faded out. But they develop their speech on time. It's not delayed, but a really red hallmark flag of either classic autism or what used to be called PDD and OS, those things are very delayed or absent. So our son had, and I wish I would have got the VHS player to where and been able to bring it with me, but our son had mimic speech at about 9 months. He met all his gross motor milestones on time. But the thing that cued me that something wasn't quite right was he had that mimic speech and it completely disappeared by his first birthday. So he was saying mama, but I didn't know any better at the time. I thought he was just saying mama for me. He was imitating me because I was saying mama. But he wasn't saying mama to get me. He wasn't wanting to roll the ball back and forth. But he was happy. He just, the engagement, the joint attention, the shared affect that you normally have in infant development wasn't where it should be. And so by the time he was probably 18 months of age, it was really much more apparent because the speech just wasn't there. And then I said to the doctor, this is not normal. And she's like, oh, but he's working on his physical development. And I said, but it's not normal. Like, you don't have language and lose what you have. And so that's the next thing I'm going to kind of move on to here is if you see kind of some of the signs we were talking about in their development and that if at least two or more of those are present, make sure to tell the pediatrician or family doctor and ask them about getting an evaluation. And then you're going to go to what they call early intervention. If they're under the age of 3, you're going to go to early intervention. And who in here knows what early intervention is? Okay. I want to know in here, raise your hand, tell me the people that can refer to early intervention. Meaning they can send a family to early intervention for services. Doctors?
Speech therapists.
Okay.
Language therapists.
Okay.
Family and consumer sciences professional.
Mm-hmm.
Had to throw that one in.
Anybody else?
A teacher, if they're maybe like a preschool age, then you
If
could.
they're preschool age, you're going to go through the schools, but
This-
good.
Well, not all of them will be in,
Oh, you mean like if it's a sibling or something?
no, I mean, if somebody was going to a private.
Oh,
a
private
pre-
preschool, I got you,
yeah,
I got you.
yeah.
Yeah. The one thing people don't realize is parents can do it themselves, and that's pretty well what we did. And so, letting parents know if they see those signs, you can do a referral, but so can the parent. the parent can call and ask them to do an evaluation on their child. And that's how our son got diagnosed at such an early age. In early intervention, there's something called CFCs, and that stands for Child and Family Connections. There's offices around the state, and I put the link here. I tried to get it embedded where it would work, and it didn't. But you can actually plug in that link, and it will tell you which county, for where you live, where your early intervention program is. And that way you can keep that as something you have in your Rolodex when you're working as professionals to pass on to people, or if you need to refer to them yourself. Our son went through the early intervention system. He got in about 18 months. They did all of his assessments that ended up getting us a evaluation for him. He was in there probably 4 or 5 months. You know, we had to fill out lots of paperwork, and we then sent that information in and we waited, and the wait is even longer now because the incidence is higher. We went through that process and we saw the old pediatrician, and I'm going to kind of go over who diagnoses that now. But when we went through that process, we went up there to Springfield. Now they do more of it down at the CFC offices, but they do multiple tests to assess if your child meets the criteria for autism. That's when I was talking about the Diagnostic and Statistical Manual. That is what they use generally, along with like MCHAT, some different assessments, ADOS. They have all different types of assessments that they use to determine, you know, what kind of needs your child has. And I'm going to move on here. I also want to talk about when they're at 3 years of age, if you're suspecting it later, the child with Asperger's, you're going to go to the school system. So I kind of wanted to go over here, like if you're in a school setting, the school is probably more than likely not going to refer your child for medical evaluation, because if they recommend it, they likely will have to what?
Pay for it.
So even though they might very much suspect something, they can give your child an educational eligibility of autism for an IP without giving any kind of referral to a medical professional. But as a parent, you really need more of the medical aspect, because they're going to give you more thorough recommendations about what kind of treatment approaches to do. So I want you to know our program does screenings here in Charleston. We are not big enough because we're not part of a university partnership that we do comprehensive evaluations. The University of Illinois is one that does, but they only do it for children that are verbal and over the age of 5. We refer though to developmental pediatricians. The one locally are Dr. Morton and Dr. Keeley. They're in Champaign. But they are hard to find in the state. There are lots of them in Chicago, and there are not very many of them downstate. And then you run into insurance issues trying to get a diagnosis. So I'm going to kind of go over here too. Other people that can refer are the family doctors and the autism programs. We can refer people and sometimes get a spot, maybe if it's somebody we have an agreement with, to get them in slightly sooner. But some people are waiting 1 year or 2 years for their children to get evaluated. People that typically do diagnose autism are a developmental pediatrician, a pediatric neurologist. So a lot of times people aren't aware that neurologists can diagnose autism. A pediatric psychiatrist. There's actually one in Sarah Bush now. So a lot of people aren't aware that there's someone that close that does pediatric psychiatry. They're going to look at things more from a psychiatric aspect, so they're going to probably be, if you're looking at medications and things like that versus a natural approach to treatment, their psychiatry is going to be more dealing with medication and things like that when you're looking at diagnostics. And then the clinical settings such as the neuropsych department, which is what I was talking about, U of I, that will do more of a comprehensive eval. I want to talk about what best practice is. It's a multidisciplinary team. They are hard to find. We originally, when we went through intervention, went through diagnosis at Springfield. And we saw a developmental pediatrician and we saw an occupational therapist. We didn't see speech, we didn't see a psychologist, we did not see a multidisciplinary team. And they had lots of people that they were serving at that time through the early intervention system, so we really weren't asked to come back for follow-up or those kinds of things. And I was 8 months pregnant with our daughter, and that was just not what I was expecting to hear. So we went and got second opinions, and we saw a multidisciplinary team at Riley Children's Hospital in Indianapolis. That was a psychologist, a developmental pediatrician, a speech therapist, an occupational therapist. If the child's got physical delays, it would be a physical therapist. You would have a whole team of people, and you'd meet with them all within a couple days. And then those people would all come together, and then they'd make recommendations. And then they ask you to come back and see them on a routine basis. That is really your best practice. That is what should be done. It's hard for parents to get. So in all reality, that should be what your goal should be, striving to help people get. But if you're going to make them wait 4 years to get it, you probably need to get them into somebody else and then see if they can get a referral from their primary doctor into a multidisciplinary team, if their insurance even pays for that. That's a whole other discussion when you get into insurance. Once they have a diagnosis, they can contact our program for a new, we do what we call new diagnosis training, where we go over some of the treatment approaches that are common for autism. And I kind of brought handouts here, and I can let you guys pass these around. These are all the different treatment approaches for autism that are out there. So when a child is diagnosed, they will make recommendations on a report and tell you what kinds of approaches they need. There's a lot to sort through. Some of these are not available in every community or area. Then you have to go read about what all those things are, all while you're still trying to grasp the concept that your child has this diagnosis, that it's probably lifelong, and you know, how do you go about doing all of these things and finding time in your day just to be a typical parent? It's very overwhelming. I know some of you in family consumer sciences have studied things about the aging and grief, and when you have a child diagnosed with autism, I'm not saying it's like losing a child, but it is a process of grieving too, because you had anticipation when you had that child of what their life was going to be like any other parent when you hold a newborn. And when they talk to you and hand you that diagnosis, and you read all these psychological reports, it's very hard, and it rips your gut out. And you don't read all the positive stuff they have in the report the first time you read it. So I just want you to understand sometimes when you're going to be working with people like even teaching family consumer science, some of those people you're teaching may very well be parents, but teaching them what soft signs to look for, teaching them about the grieving process. It's okay to feel that, and everybody's going to handle it differently. My husband just took it for what it was and didn't know what autism was, and he didn't ask. He didn't really, he's like, well, he'll outgrow it, won't he? And I'm like, not really. You know, and I, on the other hand, was more kind of like a guy myself, and I was gonna read everything on fix him. I was gonna make it better. I was gonna try and improve him to where he was pretty well, only had residual symptoms, and I wanted to move across the country, and I wanted to do everything that I possibly could. And sometimes, as a professional, when you're working with people, help them just to ground themselves, because you can really overwhelm yourself. When you look at all these different approaches, the low loss approach, when they're talking about that, that's, a lot of people know that as ADA or discrete trial. That is 48 hours a week in home therapy, working and breaking down everything you do. We did not have a behavior analyst in our area, so we had someone that was a school psychologist trained in discrete trial approaches that wrote programs for us. We didn't have any funding to pay for it. We had 15 hours a month of respite, and we used our respite provider and got her trained. We did it, and we asked the school to do it when he didn't nap. And that is how we got discrete trial for our son in preschool. It was overwhelming trying to manage all that Then people are like, oh, have you tried the gluten-free diet? And have you tried this? And so you're trying to do all these things. There's so many approaches. Find the one that's working for you and do it. And make sure you tell them to take time out for themselves, because they're going to get overwhelmed with everything they have on their plate. And we were doing that, plus we had a little one that was 2 years younger. So, and as far as the teach approach, I kind of want to go over that a little bit. That is breaking, you set up centers. If you come to visit our center, we actually have like teach workstations. It's breaking things down into smaller tasks, and then they learn independent work type skills. And you can do that easily, and you can actually tie that in with a little bit of the low-cost and ABA approach. The PEC system, I would definitely want to clarify what that is. I don't want to go in depth about it, but people, when they see visual schedules, they think that's PECS. PECS is its own thing. It is a protocol. Look it up. It is tied to ABA and communication. The speech pathology field and the behavior analysis field kind of pulls all into one. And it's all about how a child actually naturally develops language and starts syntax and putting sentences together. So PECS is actually some way to teach a child to communicate. Our son had it properly implemented in early intervention, and he was making sentences by his 3rd birthday. He could pull pictures off and say, I want, pretzels, and bring us a sentence strip. It doesn't happen that fast for every kid that does it, but he finally had a means to communicate with us at 3. Whenever he went to the school system was not trained on how to implement PECS. And we kind of went backwards for a while until they got trained. That was really important because they said they were going to implement a PECS type system for him. It was not PECS, and they cut his sentence strip down to like where only 2 pictures would fit on it. And so always as a professional, make sure you educate yourself on what it is specifically that a student's going to need, or make sure you get the help you need to implement it, because you don't want to cause that kind of difficulty, because he got stuck at I-1 for probably a year. So, I mean, he still has, and it's not their fault. I mean, we may have been in the same boat. He may have been stuck anyway. But he still has a lot of pragmatic language issues. So it's really important to know when people ask you to look into something and they hand you a paper, read it. You know what you're going to be asked to do and implement it with fidelity, because it's better to not do anything than to do it not right. So other strategies I was going to go over on the back page here is Greenspan. That's also known as floor time. We have those DVDs and books in our office. We have several books written by Greenspan. It is more of a developmental approach. It is more play-based. There is actually a speech therapist down in Newton, in Jasper County, which that's very rural around here, who is a graduate of this program up here at EIU, that is implementing this and actually does summer camps for schools and things like that, implementing the floor time approach. Inclusion, that has to deal more with schools. That is what your children are entitled to once they are age 3. So if there are an early intervention, they send them into the public school system after they turn 3, or they homeschool, or you choose private. That does not mean you just drop the kid in there. That means making sure the kid has proper supports, including them in general ed as much as possible. That should always be looking at the first placement for them, is to put them in a general classroom. We as a society used to have special everything for everybody. It's really about including that child in every setting as much as possible. There's going to be sometimes when it's not appropriate for a child that is overstimulated by that large of a number of kids in a classroom, or there's just other variables at play. But that should always be where the first approach is looked at. The social stories, those are things that Carol Gray developed. If you write a social story and it has, don't do this, don't do that, don't do that, that is not a proper social story. It should tell the child what the desired behavior is you want them to do. What it is, like if they're nervous about going on a field trip, we are going on a field trip to, St. Louis Science Center. At the St. Louis Science Center, we will see this and this and this, and these are the rules of the St. Louis Science Center. Telling them what all you want, what it is, how they might feel, but not saying, and you will not touch this exhibit, and you will not touch that exhibit. Sometimes with children with autism, if you use the word not, they don't hear that word. They hear everything without it. Because you're giving them directions on how to handle things. You want to give them the positive talk. You don't want to give them all about not. Because they're going to hear the very last word you said. And not probably was not the last word you said. Here's some resources that I wanted to give you. It depends on where you live. These are things I wanted to give you because they're online and on the left-hand side. And the EI Clearinghouse, if you contact them, has an enormous amount of material on autism. And if you have a local public library, they will ship those materials to your house. They will then, you can return them to your local public library and they will send them back for free. There is no cost to that. And when I lived in rural Farina and Watson, I didn't have a public library card. So you that are teaching, you may have families that don't live in your public library district. That is a resource you can give them. And it's not just for autism, it's for any disability. And you don't have to be an early intervention to use it. You can be a gen ed teacher that wants to educate yourself and use that for resources for instruction. You as a student can use it to write a paper. They can ship it to you. And that's what their role is, and use it. Family Matters Parent Training Information Center is down in Effingham. They are federally funded through the United States Department of Ed, and they take calls from parents and providers about special education rights. They have tons of information in their lending library that they will ship to your door and send a self-addressed envelope. They have DVDs, they have webinars that they can loan out that are actually on DVD. They have tons of resources, and even on things about if you have a child that you're teaching in your classroom, how can you accommodate and modify? They've got lists of accommodations and modifications. They are more than happy to help you. The Autism Program of Illinois is us. There's 4 university partners, and then there's 12 other centers like ours around the state. There's one in Maryville, Carbondale. I'm not going to go into a great length about where they're all at. There's one in Springfield. There's Chicago. But the Carbondale program is unique because they actually have behavior analysts that do the ABA approach along with the speech. They do it in combination with each other, and it's kind of its own standalone program in our state. StarNet. You said you live in O'Fallon. Okay, I didn't list all the StarNet offices because there's StarNet regions 1, 2, 3, and 4. 4 covers the southern territory, and that would be like from St. Clair County over to like Effingham and downstate. Coles County is more regions 1 and 3, but they don't prohibit you from participating in their trainings. Their trainings are generally free. You can get continuing ed units on them. They do them on all kinds of different preschool, and it's for ages 3 to 8 generally. They have stipends for families that they can get fellowships to pay for them to go to a conference. They'll help pay for lodging. So there's lots of things out there that can help families in that regard, as well as they offer sometimes a substitute fellowship for teachers. So, but it really has to tie, are you teaching those grade levels? So as a high school teacher, it would be kind of hard to do, but you might mention it to your other fellow staff. Public libraries generally have material there. And then if you're looking for therapies, hospital pediatric rehab programs generally have things, as do universities. Private programs, like Sarah Weiler that I was telling you about, that's down in Newton. She has her own private practice called Integrated Therapy Services, but there are different places around that you can find people like that. Our office has most of those contacts. I have a resource binder probably this thick. Family Matters has some of those resources as well. Interventions. I was talking about PECS. This right here is a PECS book being used more as a visual aid. But you can put things in order of like this is a choice word, but you can put things in order where it's horizontal and you can list like all the different things they're doing. And you can use something as simple as a dry erase board if they can read print. You can use, there's different websites you can get onto, like Do to Learn, that you can actually get to make the visuals with. This is for an older child that might already be able to read. People don't think of a cell phone necessarily as assistive technology, but it can be. Even something as simple as Google. If you have Google on your phone, depending on how their articulation is, there's a voice button on there and they can just record their note. Or if they want to search something, they can use a voice option on it. There are apps out there that are fairly free. I've got tons of apps. We've done some trainings on apps that'll help augment communications. They can type in the words and it'll speak it for them if they have a speech impairment. There are lots and lots of things. The thing I wanted to put here about the motivating objects, when you're teaching a child with autism, you want to make sure that you're using something that's meaningful to them. In other words, if you're teaching home ec, you have to teach lots of different things. And if you're teaching sewing, and you know this kid loves Mario, then try and find Mario fabric and have them make a Mario whatever. Let them use what they like and use that as a means to teach them. Likewise, if there's some sort of reinforcement system that you have in place for them, if you do these 5 things, do something they like. Don't pick something you like, because it's probably not something they It's kind of like when your husband might go shopping for you, or, they might not pick out what your friend would pick out for you. Organize your environment. That is really key. When you're organizing and thinking about how your classroom is laid out, some people are more chaotic and have more piles and things like that. It is very frustrating for a child that is on the spectrum, whether they have Asperger's or they have lower functioning autism. They like to know where stuff goes, when it starts, when it's over, and using words and things like saying in a little bit, I'll check into that, we'll see. That's very frustrating because it's not clear cut. And sometimes you don't have an answer, but you can say things like, well, after supper might work. Because that's a clear cut time. Like once we eat, then it will be this. You can't control every variable, but to the best of your ability, understand that when you use open-ended phrases and stuff, it's very challenging for the child with autism. Don't give multiple directions. Make sure when you're giving directions that if you can, do it in written form. So if you're up there teaching the class, use your chalkboard, your dry erase board. Because if you're writing it as you go, they may not take in all of your auditory, but they generally take in your visual. I mean, some kids do need the pictures, but if they're older, sometimes they can just understand your print. So make it really short and simple. Don't get lengthy, but give things in broken down steps. So if you think, just think about something as simple as how to tie your shoe. Think how many steps it would take to write out those directions on how to tie your shoe. It takes a lot of directions. Hand washing strips we have in our office are this long. So think about when you're breaking things down, start with a couple tasks and then extend it. Because if you're trying to teach them all those tasks at once, you're probably not going to be successful, neither are they. So you want to break it down and start expanding it out. So maybe you might get them to turn on the water, put their hands underneath it, and then add the steps to it. Some children catch on to it better than others. And another thing, try not to talk. If you're working with a preschooler, try and just physically teach them how to wash their hands, and then fade your prompt back to the elbow and to the shoulder, and then get yourself out of the situation. Just think about it something like toilet training. If you're helping them pull up their pants, are you going to be there the rest of their life to help them pull up their pants? So if you're sitting there going, pull up your pants, do this, you know, oh, now knees, now thighs, now hips, now, you know, okay, so now you've got to fade out all your verbal prompts you just put in there. You want to teach them as much independence as possible, as early as possible. Offer encouragement. Sometimes it's very frustrating because you want them to be able to do it quicker, faster, easier, and you don't want it to be so tough for them. Definitely give them as much positive feedback as you can. You're doing great, awesome, way to go. Don't use the same one all the time because then they'll turn to you and say, good job on the third time because you did it on the third time. But always give them encouragement. It's a neurodevelopmental disorder. I want you to know as far as ethnicity and racial background and socioeconomic background, there really is no proof that it's higher incidence in any population. Its incidence is pretty static across the board. It's more common in boys than girls. It's now 1 in 50 boys. That's a lot. I mean, you think about, in this room, there's probably, what, 25 of you? Double this room, there's probably likely going to be one person that might be affected. So it's pretty frequent. They still do not know what causes autism. There's some hypothesis that it's genetic as far as some pieces of it, but it's more likely with twins. If there's a twin with autism and they're identical twins, not fraternals, then it's more likely that identical twin will have autism, or maybe not to the same degree, but it's more likely. But it's not that it's always in boys either. There is families that we know that have multiple births and the only child affected is female. So there's no rhyme or reason to some out there. And I think as they find out more with autism, I think that it affects people so differently that they may find a genetic linkage to certain ways that affect certain people, but not every child. And there's so many variables that can be taken in hand, like what their birth was like, you know, whether they had a traumatic birth, whether they had, there's so many variables to consider. They pretty well ruled out the vaccine theory. How many in here have heard of vaccines cause autism? Yeah. They have pretty well ruled that out. The reason they thought that at one time was, they used to, for a preservative, have thimerosal with the MMR vaccine and with measles, mumps, and rubella vaccine. So they thought that that was actually, there was mercury in the thimerosal, so they thought there was mercury poisoning, so it affected them like that. So some of you in here, there's, I think, maybe a parent or two. What's your thoughts on that?
I wasn't happy to hear about it the first time I heard it, because that made it sound like it was my fault, because I didn't get the vaccine, but my daughter has had vaccines too, the same exact doctor, same vaccines, and she's fine. My son is, you know, it just happened to be, it was him who got autism, not her. I think, there's no real, they checked our genetic background too, and looked at our genes and heredity and all that. And we never could ever figure it out for sure what was really,
Yeah. So, yeah.
Can you give me a little bit of historical data? I mean, when I was in high school, I never noticed any of my friends with autism. I did a lot of babysitting. It just wasn't there. But now we get to the 90s and 2000 and probably starting in the mid-80s, it's been an explosion of kids with autism.
One thing for sure is there was no Asperger's diagnosis earlier on. So that opened up a lot more incidents because those persons that probably had Asperger's when you were growing up were your peers and playmates that you go, oh, he's a little odd. That's Bob. He's kind of different. He's a little weird. Or, boy, Bob really likes his Legos. Or, you know.
I understand what you're saying, but do I not make some sense?
You make some sense.
That I understand the whole thing about not reporting, thus the statistics were skewed, we didn't know. but I definitely believe it's a modern day social phenomenon, that autism is so prevalent among our population. That drives me to ask, do we see autism in the middle of Africa?
You see it clearly in China and all other foreign countries. It is, we have people that are actually working down in Africa with projects down there. It's just, it's,
I was gonna say too, I think in the school setting, at least when you were in school, as opposed to now, the inclusion has made such a difference, because even when I was a younger kid in school, the special ed kids, that the ones who got a little off, maybe not quite getting the good grades, they all went into a room by themselves, so I never actually saw them. And then when they went home, their parents kept them, you know, a little more around them. And I think now, you know, like my son, they're in the regular ed classes and all the kids know it, and we've made sure to inform them that this is not, you know, this isn't who he is, it's just a part of him, but that you have to do a little understanding that, you know, not everybody is exactly the same.
That's a good point.
and another point too, it's truthfully, and that this is the sad fact, is a lot of people were institutionalized.
Yeah.
So they weren't around
Oh,
you
okay.
to be seen.
Have you ever read anything on like the effects of the environment and, you know, like the whole food, you know, like just through the generations, the changes that have happened, like what mothers have been exposed to, you know,
There's lots of theories,
Yeah.
there's just no scientific data to
right.
validate it for sure. There's a lot of people that do some dietary interventions, gluten and casein-free diets. Some people have had success with it, some people have not. It all depends on the child, but it definitely has some effect on their gut and digestion. Because a lot of times children on the spectrum are picky eaters. Not all of them are, but many are, and they restrict what they eat. Some children, I know of a family that they're going through feeding therapy because their child will only eat macaroni and cheese and only pureed.
And
That's
what?
it.
And puree?
And pudding.
Oh, and pudding.
Yeah.
Oh, that doesn't sound too
And-
bad,
But
actually.
that's every day.
No, I know, I'm kidding.
All day.
I'm kidding.
Yeah.
Have you seen Simple Grandin, and what do you
Yeah.
think of recommending that to other educators? Because I use it, so I teach childcare, so my students can get a better grasp, but since you are.
You mean like the movie?
Yes.
We actually have a curriculum that we can do a training with that breaks down all the different parts of that movie and what different parts of it are, you know, this is, you know, overstimulation, this is a sensory component, it breaks it down into video segments, and
So
we can do
for
that.
the people that haven't fallen upon, I watched that instead of the Super Bowl one year and I got in trouble. But I recommend that for people to
The
watch
one
it.
thing I
and-
recommend is that people have a clear understanding. Temple is wonderful, but Temple is very high functioning. And people watch one movie and they want to think that's how everybody is. I'm just clarifying
Okay.
that, because that's kind of what happened with the Rainian phenomenon. Everybody thought everybody with autism was a savant. You know,
That's what I was gonna say too, is that then people started going, okay, so your kid doesn't do well with this or that, and it was Zach, he was totally opposite of Temple. You know, her mathematical abilities, he's not to that level. So when everyone saw that movie and she came and spoke in our community, she was great, but then I wanted to say, make sure you tell people this, they're not all the same. They don't all have the similar
yeah, my son
characteristics.
doesn't like cows at all.
Yeah.
You know.
Yeah, mine
And I want to clarify, because it's really just important, period, that everybody wants to clump everybody in society. They want to make all blondes the same, they want to make all brunettes the same. And they used to do it with race, and they did it with gender, and, you know, people are people, and you get to know them for their own unique gifts and talents and strengths, because they're all different. And just because one kid has a feeding issue doesn't mean the next does. It is common, and find out from whoever their specialists are that are treating them what they can do to help them improve.
Well, what about adult autistic people? I don't know if I know one. I have a 13-year-old neighbor who is autistic. I think that's the oldest autistic person I know.
Temple Grandin is an adult with autism.
There's a bunch of inventions, there's a bunch of people successful with
Oh, yeah.
Nobel
Yes.
Prizes.
If you want to look
But-
into the Silicon
I
Valley.
can't name them right
Albert-
now, but.
Albert Einstein,
Yeah.
Mhm.
he's
Really?
very likely on the spectrum.
Really?
And see, Albert Einstein didn't develop typically either. That's the thing, people want to think of Einstein as this wonderful genius who figured all this stuff out. But he didn't have a lot of the other social skills that were normal. He was very abnormal. People that are gifted like that are savants, people know them for their strengths, but they didn't know where all their social deficits were. And, that's what I'm saying, the Rain Man theory people think, I actually have people say, can you count toothpicks? I'm like, no. They're like, oh, you would not believe the things I've been asked. I've been asked if there was a genetic test to determine if your child had autism, would you have
She's got a PhD.
Yeah.
not terminated my pregnancy?
Yeah.
I've had that
That's a pretty cool
happen.
movie.
Stuff no one would dream of
And
asking.
you've never strangled anyone saying that yet, it's amazing.
79.
It's really awful.
So I'm just saying,
You can buy it at
and
a
people
bookstore.
honestly,
I think I read the book.
people honestly ask things out
And I
of
have
not
so I
knowing.
really
They don't have the knowledge. And I always approach whoever asks me those
always
things
been amazed.
as from that standpoint, because I think it's only right to make sure you educate people. Because if you treat them with disrespect when all it was is they just didn't know, I'm not doing anybody a favor by being rude back to them, or it's about educating. And that's why I love this opportunity to speak to you guys, because I went through your program and I didn't know what abnormal development was. I didn't know what those signs were to look for. And I thought I knew what the right ones were to look for, because that's how I figured out what the wrong ones were. And I want people to know what those atypical signs are now, so they can help somebody else. And be gentle. Don't say, hey, I think your kid has autism. That's really not a good plan. But you might want to say, hey, I got this awesome little list that I got at a training. Here is what is pretty much typical, but I got this list and I never seen one like that, and hand that to them. Then tell them, hey, check with your doctor and don't give up. Try and get them the help they need. And yeah,
No, go ahead.
go ahead.
Oh, I'm sure that no one would ever want their child to be a science experiment. But has there been any research on brain development or MRIs that are taken that they're comparing? I know there's no one theory.
They're doing MRI studies actually at WashU in St. Louis. My
Okay.
son's doctor is one of those people that's heading up that research.
Okay.
The only problem with some research is your participants are only going to be the higher people that can tolerate those things. My son is not going to tolerate multiple blood draws. It isn't going to happen. And he doesn't sit still enough that he's ever going to go in an MRI.
machine.
So I'm just saying, there's going to be limited scope to some studies.
Right.
There is something called the Simon Simplex study. You might want to look it up. And that is nationwide. That is being done at multiple universities, and they're doing blood draws. And that research probably won't be revealed for quite some time.
I mean,
But
it's
they
fascinating.
pulled from families and siblings, and the whole bit. And they're really doing some in-depth research, but they don't have any answers right now. So, and the big thing too is, quite honestly, with mental health the way it was back in the older days, there's such a stigma attached still to mental health and even developmental disabilities and disabilities in general. It's improved greatly, but those records were confidential, and if you had a family member that had any kind of mental health disorder, you likely didn't know it even if it was your own parent. You might have said your parents were crazy, but we all did. But you wouldn't have known was that person diagnosed with something, and they didn't share that information. So, and you're not going to be able to access it either, because the mental health laws are very restricted. Even if you want to go back and they pass away, you're not going to get access to it. I kind of already went over what it is. It's not savant skills. It is not the parent's fault. Bottleheim was actually someone who blamed the parents. So parents back would have had kids probably my age in their 40s that are in their 40s now. It would have been back in the 60s, 50s, 70s, somewhere in that range. They were actually told that it was their fault. They were called refrigerator mothers. There is a wonderful person here you guys have on staff at EIU that went through that process. Didn't get her child diagnosed till 8. She's female. She's actually presenting for us on the 5th. If you want to understand more about comorbid diagnosis, her name is Marjorie Hand. She's a psychology instructor here at EIU. But yeah, that's pretty much what they were told. So those parents are really mentors to some of us younger parents now. But that's what they were told. They didn't have any supports like we have now. Their children, really, some of them didn't even get to attend school in the 60s.
Comorbid diagnosis, does that mean two things?
It means like they might have a mental health diagnosis in combination with other things. Because autism itself, on a statistical diagnosis, statistical manner, is considered like what they call a code. It's called a dual access diagnosis, meaning it can be developmental if they're depending on IQ level, and it can be mental health. So it's kind of, it crosses. Mental health and developmental disabilities don't like to have their branches intertwined, and autism is the intertwining branch.
Oh.
It can be both. It's not always obvious. If it's a higher functioning individual, people a lot of times put standards to them because they're incredibly bright in a certain area. So then they think they should understand because they can repeat rules to you, but they may not generalize or understand those rules. So it's really important that you understand it. If parents telling you, but my kid has Asperger's, they don't understand. Well, they can tell me the rules. Well, they may be able to tell you the rules, but they might be able to tell you that, you know, you shouldn't talk to strangers, but if you walk them outside and say, hey, it's not a stranger, they're gonna be like, no.
Okay.
You need to make sure they understand in general what you're asking of them, because a lot of people don't, and then it escalates into a meltdown. And people can't figure out what the thing was that caused the meltdown or the behavior. Well, it was likely because there was just a misunderstanding of what the child actually understood. You don't want to think that they don't know anything or treat them that way, but you want to get a grasp of what do they understand. You know, it's kind of like, I want to say, like, I argue with my spouse sometimes.
No, really? Oh, my.
That never happens to anybody.
No.
Boyfriend, girlfriend, nothing. Okay, so I many times have the problem because I think he understands what I think. And a lot of times we do the same thing with a person with autism. We think that they understand just because we said it or taught it. They may not. Just know that they're their own person, just like you and just like me. They have their own differences. They have sensory things. You may have this person next to you that picks their pen, and that may not bother them, and it might drive you away.
Crazy.
So, be aware that they have different sensory differences. They might be a little more prominent than the average bear. They might repeatedly blink their eyes, or they might fidget, or they might need a wiggle cushion in their chair. We all have coping strategies. Some of us chew gum, some of us twirl our hair. You know, understand that a lot of times stuff they're doing is maybe how they are managing to filter everything else going on around them. Executive functioning, I kind of want to go over that. That's just, the brain normally can take in a lot of information and multitask as best as we all can. You know, we can't do more than 2 things at once usually. But those are the things that help us organize. So you guys probably all have agendas and organizing strategies and things that you use to organize yourself, I'm guessing. Yeah?
Oh, sure.
Cell phone, something? Okay. Those are things, if you can give them means to do that. So if they have a cell phone or a PDA or something, help them organize themselves with visual aids. Help them by breaking down things, like when I was talking about breaking down how to tie a shoe. Make it smaller on how you complete tasks. These are just some really good, simple ones that you know what works for your students. Stick with it. Don't change it all the time. You finally found something, and pass it on to the teacher for next year. A lot of times you get a really good teacher, and they don't share their stuff with the next year's teacher, or the substitute, or anybody else. And guess what? Billy's gonna have a meltdown because those people don't know, and he wants predictability.
That happens every year for us, every year. They'll take
Or
all the
maternity
notes
leaves,
down.
you know, people
Yeah.
have babies, you know?
Yeah.
Yeah. Theory of mind, the one thing I really want to just emphasize is this theory of mind is you being able to take somebody else's perspective. So let's say they plow over the kid on the playground. Well, you shouldn't have done that. You hurt them. See how you made them feel? That's usually not too effective because they really don't see how it made them feel. Best thing you can do is find ways of when they're sad, get some pictures if the parents will agree to it, and make a book about their different emotions. And then say, you know, whenever you had that happen to you, you know, whenever you had your toy taken, remember how that made you feel? When you pushed her, it made her feel that way. Then they can think back how to something that happened to them. But they're having trouble getting their own perspective down to that. You cannot developmentally understand somebody else's perspective till you can understand your own. So those are things to be clearly aware of. Other things is understand the intentions. So a lot of the things our parents did were, you can probably do it, probably quite well. The eyebrow thing here on your hairline. You may do that, and that probably may not, for some kids, they might catch it, but it has, usually they catch more extremes of emotion. Extreme anger, extreme happiness. So some things when you think you're giving subtle clues that are just gestural or different things, they may not pick up on that. So it's important that you give some simpler things like teaching how to read those things. Practice the social situations before you go into them, not after, not after they fall apart. Don't get into big discussions if they are falling apart. That's when you're at your peak. Think about when you're angry. Anybody in here when you're angry want people to keep talking to them? Raise your hand. Anybody want people to say, you're fine, you're okay? Anybody want that?
Go away.
That's right. So the big thing is knowing when they're at that point, you want to make it better. Just let them, keep them safe, get people around them safe, let them get back there. Because they're at brainstem level at that point. They are fight or flight, get away from me. Let them get themselves recouped and then kind of find out what it was that irritated them in the first place. Teach the concepts of those feelings and emotions, and you know, we kind of went over that, but you can get more of this information from the Geneva Center for Autism and Asperger's Syndrome and Difficult Moments there at the bottom of that slide. I kind of already went over our program. There's the Autism Society of Illinois has a website. They have people that will help with them with IEP reviews, but Family Matters will do the same thing if a parent wants help, and they don't charge. The ARC of Illinois has lots of trainings and resources, and then ISTAC, people don't know what they are. That's the Illinois Statewide Technical Assistance Committee. They have something called the Positive Behavior Intervention System. The Autism PDD and Technical Assistance Project, they have multiple programs there. And they will actually do what we call focused family support. They have a wait list currently, but they will actually come work with the school, the community, and do person-centered things around the child and develop what they call a path and a map. So they will actually work, like we went through that system, and it's basically a year-long process, but they actually worked with our church. They helped develop visual aids for his Sunday school class. Our son was included in general Sunday school class. He had visuals that he worked for certain things, and then he learned how to do church service in the sanctuary. Our son has gone to church since he was little, and he burns DVDs for our church ministry now. They're having him take pictures down in the youth department. He said he's 13, and he'll be working on making PowerPoints. He's not going to play the same things that they play the way they play them all the time, because every kid's different. Her son might be higher functioning. Her son might be able to play the games with his kids and have those gross motor skills. My son's probably not going to be that child because it's too much for him to take in at one time. He's not going to go out there and play ball at the same maturity level of gross motor that they can. He might be able to kick the ball and run to a base. That's about it. He can't process all that at one time. But he can process all the visual stuff, and he can make something that he is giving back and he's sharing and he's participating and they can talk to him about. So that's what he does. The Technical Assistance Program is really a good program. They also do what's called parent cafes. They do those in schools. So you might ask them, can you come to a parent cafe at our school and you can help get some education in your schools. We will come and do consultations in schools. So, oops, sorry. I just want you guys to think outside the box. Whether you're a student going into the field, don't always worry about what they're doing wrong. Think about their interests, think about things you can just teach them. The best teacher my son ever had was in first grade. My son flipped light switches. That's quite annoying. I imagine if anybody's in a classroom and I was over there flipping light switch on and off over and over again, that would probably make most teachers
Cuckoo.
She didn't make that a big deal.
Uh-huh.
She said, you know what, Adam, you can flip my light switches. When we go to recess, you can flip the light switch when we go out and when we come back. You can do it when we come in the morning, and you can do it when we leave for the day. Those are the rules. She made a social story, and you know what? He got his thing, she got hers, and everybody was happy. The next year he had a teacher, he liked to change the calendar at the month, because if it was gonna change the month at the end of the month, he wanted to change it. And he knew it was gonna change over the weekend, and he had a teacher. You're not gonna touch my calendar, that's my calendar.
Oh, okay. Yeah.
Now, there's times to pick battles. Was that probably one?
No, not at all. Or give him his own calendar, for goodness sakes.
You've got to learn what works. And I'm not saying you have to give in to every kid about everything, but really
Yeah.
find what their strengths are and let them be strong at them. Don't try and make Bob, that you know is probably geared to being a mechanic, and try and make him into a veterinarian. You know, it's like trying to ask an elephant to fly. Unless you're Dumbo, it's probably not going to happen. You know?
Well, didn't you say they don't like change, so maybe that was his way of controlling the change. If he was the one changing the calendar, maybe it wasn't as stressful for him to see a new calendar up there because he was the one changing it. And
Right.
maybe he needed that and she didn't catch on to that. Maybe that would have made his whole experience better.
Yeah. Well, the teacher next door let her change his calendar and it all got better.
Yeah.
But I'm pretty well close to being